So we're going to be talking about the anomalous head position in neuro-ophthalmology. And what this means is you're assuming a head position that's theoretically providing you with some type of advantage. And normally that means you're assuming a position to look away from where the deviation is the worst. So if on the efferent side, that's going to be nystagmus. We want to look in a position where our nystagmus is least. Or in strabismus, we want to look away from the weak muscle or nerve to reduce the diplopia. And so in efferent nystagmus anomalous head positions, they're going to assume a position of their head where they can have a null point, which is where the nystagmus beats the least. So for example, if someone's null point is when they look to the left, they feel like they have less jumping, they're going to turn to the right to drive their eyes to the left so that they'll be in the null point. And in strabismus, so if you have a left sixth nerve palsy, for example, here's my left eye, it's turned in because I can't abduct this left eye. If I look towards the paretic muscle or nerve, in this case to the left, it'll be worse. But if I look to the right, it'll be better because I'm looking away from the paretic muscle. So in this case, I'm going to face turn towards the left six so that my eyes will be driven to the right so that I can avoid looking to the left. And so with a left six, I'm going to have a face turn to the left and look to the right. And with, so that's a left sixth. So this is a fourth now. A fourth is going to have an anomalous head tilt. So the fourth nerve palsy is if I tilt my head to the left, my right eye wants to extort and my left eye wants to intort. And so if my fourth nerve is out, the primary action of the superior oblique is intorsion. So a right fourth, I can put my eyes in the excyclotorsion by tilting my head to the left. So in a right fourth, you would tilt your head to the left so that you wouldn't tilt your head to the right, because tilting to the right is going to make the intorsion problem worse, and that's the primary action of the right superior oblique. So the head tilt in a fourth and the face turn and the sixth go the opposite directions. So you need to know about efferent causes of anomalous head positions, both nystagmus and strabismus. In general, you're looking away from the paretic muscle or in the nystagmus to achieve the null point. And the same thing happens in patients who have field defects. So if you have a right temporal field defect, and so if I cover this eye, I can't see in the temporal side, I'm going to turn my head so that I can move my whole field into the primary position away from this temporal hemianopic field defect. And so on the afferent side, people don't usually tilt their head or turn their face unless they're monocular. However, some people do describe this. So you need to be cognizant of the fact that if the chief complaint is I'm tilting my head or turning my face, that could be efferent or less commonly afferent, and usually it's away from the deviation, which is worse towards the paretic muscle.